What we're going to get into today is how to prepare for your first office visits. When you're thinking about going to MD offices, one, how do you pick the right ones? Two, how do you prepare? Three, what's a good script you guys can follow and bring on with you? And then four, how do you kind of practice to make it crisp before you walk in your first one? All right. So
Love
Savannah,
ripping the Band-Aid off.
ripping the Band-Aid off. Everyone's got to do it. The first one's the worst, but it's actually much easier than you think. And that's where we want to prepare you, so it doesn't look like a big monkey on your back, and it looks a lot more manageable and maybe bite size. All right. So Savannah, as a physical therapist, as an occupational therapist, speech therapist, someone healthcare field looking to start to market for themselves. They want to go into a doctor's office. They maybe know they have a primary care physician, but they also like ortho, but maybe they have a pelvic floor niche. How do you decide first which doctor's offices maybe you're going to even pick to go in?
Great. So we always want to stick with number one, stick within your network. So that immediate thing that comes to mind, just like how you would build any type of small business, right? You go to your friends, you go to your family. Well, think of like your medical friends and family. You want to stick with your primary care doctor, any physician that you have a direct relationship with, or anyone that you've ever seen as a patient walking in and kind of representing yourself from the shoes of being a clinician. You're going to get a lot higher of a response rate and a more positive response rate than maybe going to some random place. So I would definitely say first things first, stick with your primary, stick with any healthcare provider that is within your immediate toolbox. Why? Because these are the providers that you already have relationships with. They see you as a patient, but also you trust them. And so innately, they're going to kind of trust you back too. So I love sticking with that. And on that same note, primary care doctors, I couldn't recommend more. I think that's really where most of our therapists get to see the bulk of their referrals from. And really in the generalized world of ordering for therapy, the primaries are typically the ones that are setting the stage and ordering things before they send out to specialists. So primaries order the most amount of therapy. I think 100% stick with your individual network of physicians, primary care doctors. To kind of go down that route of primary care doctors too, let's think about, because there's a lot of different types, right? There's family practice, there are individual practices. So we're going to want to stick with geriatricians or people that specialize in seeing older adults, as well as concierge physicians. So you may be thinking, well, they may not have a big patient panel, so why would I go after that kind of patient or that kind of practice rather? And I would say to go after concierge physicians because their practice style and how they're working with people is very similar to PTTU. So it's the same kind of heartbeat of how we take care of people and what we're doing and what we're focusing on, which is direct one-to-one care with lengthened visits. And when patients are paying a yearly fee, a membership fee typically to go into a primary care doctor and see their concierge physician, they expect that they're going to be having that hour-long visit. It's very intimate. They get to go over like everything within that visit. So in essence, you're really mirroring that same practice style. And the doctors really recognize that. And there's something that just is elevated about the experience of having a house call. And a lot of concierge doctors provide house calls. So you're naturally going to be funneled into that same world of people that typically have Medicare, because Medicare recipients, if they haven't switched to an Advantage plan, are kind of sticking in that realm of primary or concierge providers that they're seeing. And then outside of those two avenues of primary care doctors, this only specialists I'd like to see our therapists working with are one, podiatrists. Podiatrists are great because guess what? They're ordering everything that our patients need. Gait and balance, their fall risk, they have ankle sprains and diabetic neuropathy and all sorts of different conditions that they're seeing the podiatrist for, but the podiatrist is looking for a way to kind of offload it, right? Like they're wanting to stick to the nuts and bolts of what they're doing. So podiatrists are great. Orthopedic doctors are great if they are in a smaller practice.
Okay, why is that?
That's a really good question. I always say stick with the practices that are smaller and not necessarily corporate entities or hospital-owned entities, because as soon as someone else comes into play where decisions are not being made directly by the physician, there's typically a centralized referrals system. The doctors aren't even the ones ordering or directing where the patients are going. So when you have a really big group, you really get lost in the shuffle. And then also they're looking for the easy button. So they're looking for the quickest, most efficient way to refer out all of their patients to kind of one brick and mortar spot or one home care agency that just takes every insurance. And unfortunately, that's just a battle that with PTTU, we're not looking to take on that battle, right? Like there are things that you want to stick in your lane and things that you don't really want to dabble with. And really those large orthopedic groups are just, it's not worth trying the headache of trying to get into. Think you're going through the doctor, the referral coordinator, the medical assistant, potentially a nurse. That's 4 different people per physician to create a relationship with, when you could have one concierge primary that supports you with 4 to 5 patients a month. You have a great rocking relationship with them and it makes sense and they're accessible. So I love that aspect of it.
If if I have a niche, let's say I'm a pelvic floor physical therapist, I say Savannah, does that mean I only go to see pelvic floor doctors? Do I still mix in primary care physicians? How do I decide, what my first angle is going to be? Is it two specialists, two generals, or how would I go after a niche?
Okay. If you have a niche and you really like you're doing this because you want to see that grow, I'm still going to say go the primary care doctor route and then maybe have one. If let's say, for example, you start with your 3 to 5 physicians, maybe 1 or 2 of those are specialists or OBGYN or things of that nature that are ordering for that kind of stuff on a regular basis. But guess what? If you open the floor to that primary being able to order that for their patients, they're going to have that wow factor. Wow, I didn't even know this was available. Wow, I've been looking for something like this. I refer my patients out to all sorts of different places just trying to find resources for them because I never knew that this existed. So the primary, again, is that first touch point, and then the primary is typically referring out after that. So you'll catch them before they go to the OBGYN, before they go to all their specialists if you hit the primary first. So you target them and you say, this is my specialty. And
Yeah.
then, you know what? Actually, while we're on that note, if they say, oh, well, we don't really refer out for that, well, who do you refer to then? Right? Who's in that doctor's network? So you're immediately starting to build. Now you have a relationship with that primary,
Yeah.
what OBGYN that they're referring to, and then you can make a relationship with all 3 of them. Why not? And then go into the OB and say, hey, I met with Dr. Smith. He recommended that you're the one that sees all of his patients. You must be phenomenal. I'd love to introduce myself. Does the doctor have a moment that I can say hello? I have a really unique specialty that I'd love to share with your patients.
Yeah. Love it. When you're thinking, okay, maybe the only person I know, the only doctor I know is my primary. What's a good action step that a therapist could take, whether it be Google, whether it be Zoc? Like, how do I look up to see, okay, where am I going to pick some doctors, or how do I find out about what's around me?
Okay, so first things first, you're picking the doctor based off of, like, let's say if you could have filters on the criteria that you're looking for, these are the filters. 1, the type of specialty you're doing, which, by the way, I will also wanted to add in pain management. They're referring a ton to therapy, so add that onto your list. But focus on the 65 plus population, people that need those specific things that are related to that. So fall risk, chronic decline, things of that nature. But you're really building it based off of proximity, because where you are, you're doing this because you want to build a really tight knit community and a network of patients that are in a very small vicinity. So you want to visit those offices that are maybe within, I would say max, unless you're in a more remote area, a 5 to 10 mile radius. Like, try to hit all the places that are really close and local to you. And then on that note, you want to be efficient with your time. So think about this, right? If you're hitting 5 offices that are within a 5 mile radius, you can do that in an hour. You could do
Yeah.
it in two hours max, unless you got a really good visit and you're chatting it up with the doc, then you might have a little bit longer time. But yeah, you definitely want to use maps, use Google to your advantage. And then next to that, kind of like how we were talking earlier, that word of mouth. So, oh, well, who do you refer to for this? And then maybe you make that other connection.
Always, always, always at the end, whether it's whether it's you have a patient, whether it's you have a doctor, and either you make the connection or they say they don't want to come on board. Always end every, let's call it sales call, relationship with, okay, great, who else do you know XYZ?
Mm-hmm.
Every time you're talking with someone, the conversation should always finish with, okay, great. Who could you point me to? Who else? If you're asking for those I guess, relationships and connections, you're going to come across one who gives you five. And that's going to open the floodgates for you, whether it be patients, whether it be doctors. So I love that tip.
Yeah.
All right, let's switch gears into how do I prepare? Meaning, what do I wear? Do I bring anything with me? I'm so nervous, Savannah. What do I go in? Do I have any stuff in my hands? How should I prepare in advance for, walking into that first office?
Well, first things first, take a mental step back to like the 60s and 70s when everybody would just walk around like, oh yeah, you talk to your neighbor like it's no big deal. Put yourself in the mindset that you're walking in somewhere and you know that person already, right? Like you're just going in, of course you're introducing yourself to them. Of course you don't actually know them, but put yourself in the mindset that you're just community building. There is nothing, we create so much social anxiety around trying to walk into places, introducing ourselves and overthinking it. There's no reason to overthink it. Go in there and be your authentic self. And in doing that, you are going to resonate with whoever you talk to because they're like, wow, this person is not selling me. They just want to get to know me and I want to get to know them, because most of the time people are going in there, hi, my name is Savannah. I represent PTTU. These are my business cards. This is my rack card. We do this, we do that. And already you don't want to listen to me. I'm boring. There's nothing relational about that. So the two words I really want to hone in on with this segment and topic is relational versus transactional. Make every touch point relational, not transactional. Of course, the transaction is giving them practice information, but do it in a way that feels like you're their neighbor. You're trying to connect with them. You don't want to create space between you and the person that you're talking to just in the way that you carry yourself. So keep it simple and don't overthink it. Those are the first
Okay.
two major steps.
So do I bring in, business cards with me?
Yes, but don't leave
Okay.
everything. Don't walk in there and give them a stack this big of business
Yeah,
cards and
exactly.
and your rack cards and like literally like, I'm moving in, I'm putting all my stuff out on the desk, blah blah blah. It's great. They invite you to do that. Thank you so much. I'd love to do that. But honestly, I want one of my business cards in your hands because I know the patients are grabbing stuff from the lobby, but I'd really like to connect with you. So here's my business card. And I look forward to the opportunity to getting to see one of your patients. So typically on my first visit, I'm only leaving maybe a small stack of business cards and one rack card, or several rack cards and one business card, but I'm never like giving them everything, because then when you go in the next time, you're like, wait, I have nothing else to give. I ran out of things to kind of, to have in your arsenal.
Yeah, I would say, what is the biggest mistakes therapists make? I mean, I feel like it is the word vomit. It is the listing of, it's like anything, features of like, hey, I do this, 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 this. I only take this to this insurance or cash pay or this. What are the most common mistakes? And then how do you, I guess, correct them?
The common mistakes are listing from the get-go your restrictions. And it's in the way you're saying it too. So one, if you're restricting, let's start with insurance, right? We only accept Medicare Part B. That doesn't sound very, it doesn't sound really like, wow, that's great. I'm a house call therapist. I provide care for patients that do have Medicare. So if you have anyone that comes in and they have that little red, white, and blue card, I'd love to work with them. Something to that nature, where maybe you bring in that topic of insurance while not making it sound limited. Because as soon as you limit what you're doing, what you're saying, or your personality in and of itself, they feel that, and they feel that they too are limited. So it's either that, or on the other end, like you said, word vomit, which we're all victims of it.
100%.
10 times out of 10, you're going to walk in somewhere and fumble. You're going to fumble once. You're going to word vomit. You're going to be like, that was so embarrassing. I don't even know what I said in there. Like I literally lost myself, which is fine. Those are the teachable moments. And that's really where you start to learn that this is like there's space for you to be able to do this in a very simple and strategic way, which is why it's so important to practice, just like anything you do. So
And
yeah.
that's a great segue into, what I found is very helpful is making up a script for yourself, is putting words down on a little piece of paper and then practicing it, reading it out loud. So when you're going in there for the first time, you have an idea of, at least the outline you're going to follow. Obviously, things aren't going to be followed word for word because you're going to start talking with someone and then, the conversation will evolve from there. But let's dive into, what is maybe a general script, outline, or points a therapist walking in for the first time to an MD office could follow.
First things first, when I'm walking in, make sure that your body language is welcoming. So I'm typically waving, hi. If they're on the phone, I'm not going to be loud, but hey, wait for a moment for them to receive you. I'm Savannah. I'm a physical therapist. I work with PTT. What's your name? So tell them who you are and then find out what their name is. And then, of course, remember what their name is by the end of the conversation. So immediately shift the focus to them, because this is not all about you. You're trying to build a relationship with them and connect with them so that you have the chance to work with their patients. So ask what their name is. And then I typically say something that is like relational. Oh, you have such a warm personality. It's so nice to come in here. I already feel like I'm well received. Or I just create some type of positive connotation so that they feel that I see them and I see the effort that they're putting in towards like welcoming me positively. Or on the other note, if they are not receiving me well and they look really stressed, I will say that. It looks like a super stressful day for you. I get it. I just came off a tough call with a patient. So let's get right to it, and just like meet them where they're at. If you're not meeting them where they're at and you just start hi and go in your robot mode, you're not going to get anywhere. So
yeah, I love that.
Meet them where they're at. And then from there, now I'm so off the cuff that it's like I have, 1,000 ways to say everything, but that's the best part about it. So I provide house calls for, I provide house call physical therapy. Typically, I'm seeing a lot of orthopedics and patients that need help with balance. I'm sure you have patients that need this kind of care. I'm actually a neighbor of yours. I live right down the street. I'd love the opportunity to work with them. Who do I need to speak to in order to make sure that my practice information is in the right hands of the person that is finding these resources for your patients? So you introduce yourself, you get to know who they are, you say one or two things. I didn't say Medicare. I didn't say, maybe I dropped a diagnosis and I dropped a house call. Neighbor. Those are my three major things. And then 4, action. Find out who's the person you need to speak to, or it's so great to meet you. I'd love to meet the rest of your team. Who else is around here that I can say hello to? Just make it feel natural. Like I walk in there and I literally am looking at that person like, you're my family member now. Like, and in doing that, they feel your warmth. They feel like the connection is more accessible. So
what I love that you did with that script right there is you didn't say, hey, do you think you have any patients, or do you have any patients I could see? You didn't start the conversation or even end the conversation with like asking for patients. That is not what you are doing when you're walking into the clinic. And the way you ended up was even perfect too, because it's not like, and this is where some PTs or just people in general aren't great with not being assertive, but being direct. Is like when you're there and you're talking to the front desk person, you don't want to ask them if they have time or if they have this or that. You said, who do you know? And then just be quiet. Let them respond. It's not, does someone have time back there that they may be able to come out and meet me, or is anyone around right now? Say, no. Who do you know? XYZ that I could get introduced to, etc. And then just be quiet. Shut your mouth and let the wheel start turning in their head and start thinking, okay, who could I possibly introduce them to right now? The moment you ask for permission, like, hey, can I start seeing these patients? Or hey, can you bring me back right now? And just say, nope, who do you know? XYZ, which I love.
Don't leave them with an answer, with a question that they can say no.
Yeah.
Because if you,
that's smart.
Doctor? No. Can I see your patients? No, maybe. It's such a, and again, that's how the typical person that is going into a space in marketing is saying that, oh, I need your patients. You haven't sent me a Medicare patient. Again, you're creating that transactional essence when you could really be making it relational. Oh, again, just try to create some type of action at the end so that your visit is not just you're seeing the person at the front desk and then you're leaving, which sometimes that person that's sitting at the desk, so don't forget this, that could be your referral coordinator. That could be the person that is right in the ear of the doctor. So you want to create a good relationship with them, but 9 times out of 10, that's not the person that's kind of handling everything.
100%. So just summarizing for everyone, you walk in, you start with a question like, hey, how you doing? Positive mindset. You're not going in there saying, my name's Adam from this. Don't hold that in. Just get it out when you get there. Start with asking them a question. How are they doing? Good. Point something out about them, whether it's in a really good mood, whether it's in a bad mood, and you've just had a bad experience. So try and level with them. First question, level with them, get like a laugh, get just a conversation going, then get into just a small, 2 to 3 sentence. I'm a house call PT. I actually live right around the corner here. I see these types of patients. Put that in your mind. And I love the opportunity, like you said, to work with some of your patients. Finish it. Who do you know, or who is in, what was that last line?
Who would be the best person for me to be connected to that
yes.
Opens up the resources for the patients or find resources for patients. I love that word resource because it doesn't feel salesy. It's like, I'm a resource because you literally are. You are walking in as a person that can help them. And that's exactly what you're trying to do. So be concise and be direct and pick 1 or 2 things to talk about. And the next few times you go in, do the same exact thing. Don't overthink it. Keep it simple.
And then to practice with your spouse, your friend, something. Have a general conversation before you go in. If this is the first time you're going into an office too, you have to have a couple practice reps at it. It still won't be perfect the first time you go in, but that's okay.
Just like we're practicing right now.
Yeah,
we're literally talking back and forth and practicing with each other. So it's the same exact thing. And we don't get good at it by sitting around and doing nothing and staring at a wall. You get good at it by continuing to say it over and over again and finding that repetitive aspect of it to where it literally comes out of my mouth. When I say that, I feel like it's so natural. It's just, I didn't have to write it down. It's right off the cuff. It feels good. It's in how I speak. And that's exactly how you want it to feel, from your words to their ears.
Yeah, like I said, rewatch this video, rewind it back, write it down, just a little funnel, start with this, and then you make up a little bit, you can always personalize it, the patients you'd like to see, where you're at, maybe it's a niche you're talking about, and then just close it off, and then you're asking for, you're making the ask at the end, and then you're going from there. And that's your step in the door, and then that opens up all these other things. So that's a really good overview, Savannah. Thank you for how to kind of, rip off the Band-Aid and picking your first office. How do you prepare for your first office? And what's maybe a general script I can use for going into my first office or two?
100%. It's just like you're talking to your patients. The way you talk to your patients is the way you talk to the doctor's offices.
100%. Great. Like I said, we'll dive deeper in another episode or two, I'm sure. But this is a really good intro for you guys to take, rewind, watch. You got it saved here, and use it.
Absolutely.